My name is Mary Lloyd Ireland, and this talk is about X-rays, what plane views, and when to order advanced imaging. This was presented at the Essentials of Sports Medicine, From the Sideline to the Clinic, formerly the American College of Team Physician course, Part 2. The course was in San Diego, February 2017. The learning objectives: know the images and position of the patient to order for certain diagnoses, understand when to order advanced imaging after plain X-rays. I have no disclosures. This is the different sections of this talk. Introduction, we'll do lower extremity starting at the hip and going all the way down to the foot, and then conclusions. Thomas Byrd, who is in Nashville at Nashville Sports Medicine Foundation, has been a pioneer in hip arthroscopy, and I thank him for sharing these hip images with me for this presentation. Radiographs. The hip radiographs that you want to get are an AP pelvis, including both hips. You can look at symmetry, look at the SI joint, look at the pubic symphysis, and look at the acetabulum and the femoral head. Properly centered to assess the radiographic indices. This allows comparison of contralateral hip for subtle variations and also allows assessment for surrounding areas, the ilium, ischium, pubis, sacrum, and SI joints. Lateral view. Typically we do a frog lateral view of the affected hip. So this gets a lateral of the proximal femur, not really a true lateral of the joint. This is a consistent, reproducible study. You can also do other views, particularly if you're looking for advanced imaging of the hip, such as spurs off of the femoral head or the acetabulum. And these would include a cross-table false profile done for specific circumstances. The X-ray techs should be able to do these, and these other series are used in more advanced hip cases. For FAI, or femoroacetabular impingement, the imaging is helpful in identifying morphologic variants that may predispose to intra-articular pathology. The two types of FAI are the pincer and cam. The pincer is acetabular retroversion, so it's on the acetabular side. And the signs that we look for to determine acetabular retroversion are the crossover sign and the posterior wall sign. Arthroscopic parameters are a more sensitive indicator. The second type of FAI is a cam type, and this is actually a proximal femoral deformity, as in a slipped capital femoral epiphysis, occurs when the femoral head slips posterior and medial. This is the so-called pistol grip deformity that occurs when the epiphysis heals that way, and this creates the pistol grip appearance of the proximal femur due to premature physeal closure. CT reconstruction is excellent for determining the three-dimensional architecture in the proximal femoral pistol grip or cam type deformity for FAI. FAI can exist with pincer only, cam only, and oftentimes is both. Radiographs, helpful identifying morphologic variants predisposing to this intra-articular pathology. FAI of the cam type CT reconstructions do show this very well, and this is an example of a CT reconstruction in a normal hip. Low-resolution studies with a small magnet are unreliable except for obvious things such as avascular necrosis. So this is a small magnet. This is what the femoral head looks like in avascular necrosis. But you can see how poor quality this is, that you can't really see much about the tendons about the hip abductors, gluteus medius, iliopsoas, or the labrum, or actually the articular cartilage. So you can see the big picture of collapse or AVN, but not little details from the labrum or the tendons about the hip. High-resolution magnets are better, 1.5 Tesla or more, now up to 3 Tesla. Reliability is improving. There's indirect evidence that if you have an effusion cyst, subchondral cyst, that something is going on with the labrum or the articular cartilage. And you can see here where there's a little labral degeneration here with the cystic change in the bone itself. Magnetic resonance arthrogram, as shown here, you can better see the delineation of the articular cartilage of the femoral head and also the labrum. As you can see here, the superior labrum, the inferior labrum, and then the capsule as it goes down around to the neck in this normal study. Radiographs. These are helpful in identifying variants. We also measure a lot of angles. Dysplasia, you have a reduced center edge angle or CE angle, and these are some of the templates that are placed on top of the hip to measure these angles. Radiographs of FAI, there's a CAM type, and this is the three-dimensional CT scan that I talked about to better identify the pistol grip deformity or what happens in the proximal femur. This is normal appearance. Rim impingement, this is more for the pincer type, or these signs are the crossover sign or the posterior wall sign indicating the acetabulum is retroverted or pointing backward. So this is the crossover sign indicating acetabular retroversion. And then the center of the femoral head. And the crossover sign, that's the back of the acetabulum there, indicating there's femoral side is okay, and the acetabulum is retroverted, as in a pincer type FAI. Center of the femoral head, and again the acetabular orientation. So with radiographs and with taking care of patients and interpreting the radiographs, you look for what you know and you find what you look for. So advanced imaging is definitely indicated if something is unusual, out of the ordinary. In my opinion, I would seek consultation from those who you trust, and a good orthopedic consultation is better than a lot of advanced imaging that may not give a diagnosis. Seek earlier consultations rather than getting more radiographic tests. If your orthopedist wants every test imaging done prior to being seen, I would suggest having another orthopedist as your consultant for that particular patient. . Thank you very much for your attention. Water bucks in Africa. These are the references for knee radiographs, views to get, and osteoarthritis. So with radiographs and with taking care of patients and interpreting the radiographs, you look for what you know and you find what you look for. So advanced imaging is definitely indicated if something is unusual, out of the ordinary. In my opinion, I would seek consultation from those who you trust, and a good orthopedic consultation is better than a lot of advanced imaging that may not give a diagnosis. Seek earlier consultations rather than getting more radiographic tests. If your orthopedist wants every test imaging done prior to being seen, I would suggest having another orthopedist as your consultant for that particular patient. Thank you very much for your attention. Water bucks in Africa.